I'm Dr. Christo Zuves at HRC Fertility in Foster City. Today we're going to talk about the immunology of pregnancy. Have you ever wondered why the baby is not rejected, given that the baby is always genetically different from the mother carrying? Now, we talk about pregnancy being a miracle. It is, and even more than we realize. The egg and the sperm get together and they form the conceptus, which is the fetus and the placenta. And what makes this a miracle on top of a miracle is the fact that the conceptus is genetically a mix of the sperm and the egg. It is exactly like a transplant. It is not identical to the tissue of the woman who carries the baby. The immune system patrols looking for invaders, which could be pathogens or tissue that is not self. So how is it that a woman can nurture a genetically different being inside of herself without rejection? If you think about it, we cannot do things like organ transplants without having a close tissue match and without taking immunosuppressant drugs. So how do women do this? So women have evolved a remarkable ability to shield the developing baby from immune attack. Now, if this elaborate method of protecting the transplant from being rejected does not work perfectly, it can either lead to failed implantation, early pregnancy loss, or later on intrauterine growth restriction called IUGR, or pregnancy-induced hypertension called PIH. If these three mechanisms work well, then the pregnant woman is in the nurturing or TH2 state, whereas failure of any of these three mechanisms could move the patient into a TH1 state, which is hostile to pregnancy. The good news is that we can do testing which will tell us where a woman falls on this spectrum and apply the necessary treatment. So sometimes infertility or recurrent loss is due to immune activation. And here are some of the tests that we can do to see if we are in the TH1 dominant state or not. So here you can see the tests. We can test for anti-thyroid antibodies. We can test for anti-phospholipid antibodies. And we can also test for cells called natural killer cells, which are the soldiers of the immune system. They are dispatched to attack either a pathogen or some cell that the body wants to get rid of. And they produce toxic chemicals called cytokines. And the two that are most important in reproduction are TNF-alpha and gamma interferon. So if we identify and find these antibodies and cells and cytokines present, they are treatments that we can apply. Given that we transfer tested embryos one at a time, we need to be looking into the immunology of pregnancy, as well as looking for evidence of inflammation and infection in the endometrial cavity when we fail with the transfer of a normal or euploid embryo. Scan the QR code and set up a consultation, either in person, by video, or on the phone.